Okay, welcome back to today's webinar on laser therapy for prevention of muscle injuries. My name is Dr. David Kanashko. I'm the Director of Education, Training and Research here at Meditech. We're located, if you don't know, in Toronto, Ontario, Canada, and we're manufacturers of photobiomodulation medical devices, as well as operating a large outpatient clinic. So a few things for housekeeping before we get started. Typically, my webinars are recorded, and what I do is I have them edited, and then as long as you register, you will receive an email that has a link to YouTube to watch it again. So if you have to leave early or you can't tune in or what have you, as long as you register, you should still be able to watch the actual webinar at another date. Otherwise, they go into our archive on our support page, and the only way to access our support page is if you have BioFlex equipment. Okay, so today's topic is on prevention of muscle injuries, and the reason why I've chosen to do this topic is that there's a fair amount of research over the last 10 years on using photobiomodulation prophylactically, as well as after muscle use, like exercises or what have you. And the idea here is to be able to prevent muscles from being injured, to prevent delayed onset muscle soreness, and to actually prevent injuries while a person is doing or performing their sport, whether it's running or playing soccer or what have you. But also, of course, you can use laser therapy for treatment of muscle injuries like muscle strains, for example. So there's been a lot of research in these different areas, and I wanted to go over a bit about this so that everyone has a better understanding of how they can use our equipment to do that. So what I'm going to do is do some anatomy review, very basic, go over the effects of exercise with respect to what's going on physiologically. I'll talk about oxidative stress that is created if you exercise too much, and muscle healing, how muscle tissue heals. I'll present some research papers on photobiomodulation and the effects on muscle tissue, and then I'll talk about how you can use your equipment, if you have our equipment, to use it prophylactically to prevent injuries and also to treat injuries as well. So remember that this webinar, you can't talk to me. I have your microphones muted, but you can type in your questions. So as we go along, if you have any questions, please type them in, and I'll get to those at the very end. And so we'll have a bit of time for Q&A at the end of the webinar as well. Okay, so some basic anatomy review. Many of you, or probably all of you, are aware of these structures, but if you break down and look at the different sections of a muscle, for example, we know that the outer covering is called the epimysium or epimysium, and then there's bundles within that surrounding different muscle fibers, and one large bundle is called the perimysium. And then breaking that down into even further muscle bundles, you have the endomysium, which is around a specific muscle fiber itself. So if we look at say muscle fiber, a section of a muscle fiber, of course, it's going to have a nucleus. And of course, there's lots of mitochondria. And this is really important because the main target for photobiomodulation, there's two really main targets. One is mitochondria themselves, and also white blood cells and blood. If you think about the number of mitochondria in a typical skeletal muscle fiber, it's upwards of thousands, sometimes greater than 4,000 mitochondria per muscle fiber. So muscle cells respond quite well to photobiomodulation. And this is in part why they heal much faster when you apply photobiomodulation, and why you can have an impact on muscle fibers even before you use them. And I'll talk about that. Now, if we look really carefully within sort of sections of muscle fibers, and the white around here is the endomysium, and attached on the outside of a muscle fiber are myosatellite cells. And these are stem cells. these are critical for repairing and forming new skeletal muscle fiber cells. So satellite cells are critical in our understanding that when you have a muscle injury, a strain, or if you have done a strenuous workout, maybe lifting weights or what have you, you may have some damage to the muscle fibers. And in part, they're going to repair through satellite cells. It's a well-known, established sort of research fact that photobiomodulation increases the number of satellite cells available to help with muscle fiber repair. So let's talk a bit about the effects of exercise. And when I talk about exercise, I'm not talking about, just say walking or whatever. I'm talking about fairly vigorous exercise, say running, playing soccer, those kinds of things. So training, for example, is a constant cycle, right? So when you train and you say you run or you play tennis or squash, there's a cycle of stress to the muscle fibers, and then there's a period of recovery. So a relatively hard workout will cause both metabolic and structural changes in the muscle fibers themselves. And then there's an adaptation that occurs because of this metabolic and structural changes. And during this recovery period, when you give your body time to rest and recover, this actually is what makes you stronger and fitter. So these adaptations, generally speaking, are good when they're temporary. So for example, you do a workout, you give your body time to recover, and maybe you go for a run in a couple of days, that kind of thing. But when they become chronic, by that I mean if you're using your muscles in a very sort of vigorous way too often and not allowing for proper recovery, then long term you can make those muscles actually weaker and more fatigued. So this isn't just for exercises, this may also be for occupations as well when you think about it. So oftentimes you're getting patients in, say that, do construction work or repetitive work, and the muscles become fatigued and eventually become weaker. And this will lead to everything from myofasciitis to myositis and even tendinopathies. So after repeated strenuous exercise, with insufficient recovery, you can actually end up with chronically elevated, what are referred to as inflammatory cytokine levels. And this can interfere with muscle function. So if this inflammatory response actually increases oxidative stress, and I'm going to talk a lot more about oxidative stress. When oxidative stress is uncontrolled and gets too high, this will actually trigger the release of inflammation-promoting cytokines, and this leads to more oxidative stress. So it's a vicious cycle. And this is something that's really important to understand if you're working with, say, patients that are athletes or people that are in this scenario where they're not allowing their body to give the appropriate time to recover. Rested muscles stay in a relatively what's referred to as a reduced state. So when you start exercising, this actually generates an oxidative stress. And this balances out this reduced state and it actually puts you in an optimal balance sort of zone between reduction and oxidation. So basically you're maximizing the amount of muscle force that you can generate because of this balance. But if you exercise too hard or too long, then the oxidation is tilted or shifted such that the muscle performance starts to decrease again. Here's a little diagram. By the way, the reference for this is at the bottom. It was actually a really great article by the magazine called Outside. And I thought it was really quite well done. That's why I'm referring to it. So if you look at on the left is a reduced state, and on the far right is an oxidized state. And if you look at a generalized rested muscle, so let's say you're all rested and everything is good, you're sort of in this relatively mildly reduced state. Now, if you have rested muscle tissue and you're ingesting lots of antioxidants, say like vitamin C or what have you, then you actually shift to an even greater reduced state. And this is really important because some of the research that's coming out right now is actually indicating that you perhaps should not be taking antioxidants if you're doing a lot of exercise. So what happens is when you start to exercise, you can see it starts to shift towards more oxidation, and you sort of get in this zone right in the middle where there's a nice balance between what's called a redox balance, where you want everything to be, and you're getting maximal contraction and maximal efficiency of your skeletal muscle tissue. But as you start to engage the muscle tissues for longer and more strenuous periods of time, you start to shift towards an oxidized state. If this becomes chronic, where you're overusing the muscles and not allowing them to properly recover, you become basically into this chronic disease overtraining state, or OTS. And that's really important, because if you're dealing with athletes or people that aren't allowing themselves to recover properly, then you start to get these injuries and different problems. So in this particular article, it talks a bit about the exercise-induced oxidative stress. And we know in humans and other aerobic organisms, there's constantly production of free radicals as part of a normal metabolic sort of process. And these free radicals are defined as either molecules or parts of molecules that have one or multiple unpaired electrons. So these free radicals typically are derived from oxygen, and they're called reactive oxygen species, or ROS. I've talked about ROS quite a bit in previous lectures on photobiomodulation. So although free radicals can have positive effects in the immune sort of system and cellular signaling, they can also, especially if in high concentrations, can have negative effects. And this can lead to oxidative damage of lipids, proteins, and nucleic acids. So there needs to be a balance with respect to this ROS in the cells. So this redox balance is maintained inside your body by a complex regulatory mechanism. There are various physiological stimuli when you think about, say, radiation, alcohol use, smoking, excessive exercise. These can disturb the redox balance and potentially shift it into more of an oxidative stress. And this is what you want to avoid. So this little diagram here shows you that certain stimuli will shift that balance. And we know that oftentimes people take antioxidants to try and shift it back, to that normal sort of homeostasis redox balance. The issue with antioxidants is if you're taking too many antioxidants and you're not undergoing, say, regular exercise, if you're undergoing too much exercise, then antioxidants may actually be bad. So antioxidants are great, but you need to make sure you're taking them appropriately with the kind of exercise regime that you're doing. So exercise-induced muscle damage promotes infiltration of certain white blood cells like neutrophils and different types of macrophages at the site of injury. So there's always injury when you use your muscles, right? If you're running, playing tennis or what have you, especially vigorously, you know there's muscle damage because your muscles are sore after the event. The next day their muscles are sore. Well, that's because of exercise-induced muscle damage, like delayed onset muscle soreness. These physiological changes that occur, especially after acute exercise, increases the ROS, or free radical production, and this can lead to some damage. So if you look at muscle healing, let's say you play tennis or squash or whatever it is, and your muscles are quite sore afterwards. There's that acute phase of tissue disruption, and then that enters into a subacute phase with healing and fibrous tissue being formed, and eventually it's more of a chronic phase after maybe a week or two, and then fiber regeneration and remodeling. So that's basically the muscle healing stages. So injured muscles can actually initiate regeneration fairly quickly, and that's because there's lots of blood supply. However, this can be inefficient and it can be hindered by scar tissue formation. So it's important to understand that if you have excessive scar tissue formation, you can actually lead to long-term damaged muscles that make those muscles more susceptible to injury. So this will contribute to recurring muscle strains in the same muscle group when the person goes back to running, for example. So after injury, the muscle undergoes a distinct set of healing phases. There's a degeneration inflammatory phase. This is fairly quickly, occurs within a few minutes, up to maybe 1 to 2 weeks post-injury. Then a regeneration that takes a little bit longer, maybe up to a week or two, usually peaking at a couple weeks and then decreasing after 3 to 4 weeks. Now remember, I'm really talking more about significant muscle strain here, not just very minor kind of general soreness. We're talking more about a strain here of muscle tissue. Fibrosis, generally speaking, takes a little bit longer to occur, up towards a month of post-injury. Excuse me. So if you look at this sort of diagram here, you can see on the far left is the initial phases, and then you get into regeneration and then fibrosing. The idea, what you want to do with your patient is you want to maximize regeneration and minimize fibrosis, degeneration, and inflammation. And that's, of course, where laser therapy will come in handy, because as soon as a patient has an injury, you should be treating it literally within that 24-hour period of injury. But I'll also talk a bit about how you can use it prophylactically as well. So when you think about what's going on with respect to inflammation, very quickly, I talked about macrophages, and there's different types of macrophages, what are referred to as M1 and M2. M1 are the ones that initially occur in a injured tissue area. So let's say, you have a bit of muscle soreness after lifting weights. These will start to secrete pro-inflammatory cytokines. You can see all the different types on the far left. And then it will start to shift towards M2 macrophages, especially when you have the sort of resolution of inflammation. And this, of course, is pro-healing. So anti-inflammation, pro-blood formation, pro-wound healing. And you can see the different anti-inflammatory cytokines that are affect that area. We know from research that photobiomodulation increases anti-inflammatory cytokines and decreases pro-inflammatory cytokines. So the quicker you get to a muscle injury, the faster and quicker that patient will resolve. So if you're treating, say, you want to treat someone that's doing a vigorous exercise regime, weightlifting or whatever, you get them in literally right after their exercise. Within an hour, 2 hours would be the peak best time to see them. Of course, the next day you can as well, but you'll have an even greater impact on seeing them right afterwards. So remember earlier I mentioned about satellite cells. Satellite cells are critical because these stem cells will help to repair muscle fibers that are injured or regenerate new skeletal muscle fibers. And we know that research has shown that low-level laser therapy increases the number of these satellite cells. So photobiomodulation will actually help with many different aspects. It will help with the satellite cell activation and proliferation. It will help with specific growth factors with healing, and it will help with microcirculation as well. So how does it help with inflammation? I've shown these slides before, but I just very quickly want to mention that low-level laser therapy or photobiomodulation will increase M2 macrophages, will decrease neutrophils, and this will help shift towards and break up the cycle of inflammation, especially chronic inflammation. It will also lead to decreased oxidative stress, and I'm going to talk more about that as we go along. And it will, of course, also increase anti-inflammatory cytokines and decrease pro-inflammatory cytokines. It's also known to decrease substances like prostaglandin that causes pain and swelling. So let's look at some of the research. This particular paper in 2012 was published on photobiomodulation on the effects of progressive intensity running. And they looked at performance, muscle status, and oxidative stress. So it was a randomized, double-blinded, placebo-controlled crossover trial. 22 untrained male volunteers. They were using 810 nanometers, 200 milliwatts, 30 joules at different sites along the quads, hamstrings, and gastrocnemius and calf muscles. They did the laser therapy 5 minutes before the progressive intensity running protocol on a treadmill until the subject was exhausted and they had to stop. The results were quite conclusive that when you looked at the total time for exhaustion, that when they added laser therapy to the mix, they were able to run about 14 to 15 seconds longer if their muscles were treated with laser therapy. And if you look at absolute and relative VO2 max, it also was improved with respect to post-laser therapy compared to the placebo control. So they concluded that it was possible that pre-exercise laser therapy helped decrease oxidative stress, leading to delay in the development of skeletal muscle fatigue improvement of skeletal muscle performance, and prevention of muscle damage. So let's say you're working with athletes, maybe triathlon, marathon, runners, anything where there's a fair amount of aerobic respiration. You can actually do well with your business to promote the use of laser therapy before their event. You can maybe do a mobile booth, for example. You could perhaps have them come into your clinic the day before or the morning before they go out for their exercise and or their event. Another paper published on photobiomodulation, the effects of exercise-induced skeletal muscle fatigue, and they were specifically looking for biochemical markers related to post-exercise recovery. They looked at 9 healthy male volleyball players. They received either active laser therapy or placebo at 2 sites on the biceps. And then the intervention or the laser therapy or placebo were applied a few minutes before the exercise. Notice that it's always just almost right before the exercise, although research has shown that you could probably do it up to an hour before the event, maybe even longer. So all subjects performed voluntary elbow flexion repetitions, so like a bicep curl, with a workload of 75% of their maximal voluntary contraction, again until exhaustion. You can see that, again, they used near-infrared wavelength, 200 milliwatts of power. The results were the number of repetitions post-laser therapy increased from 35 to about 40, so about 5 more repetitions, so 15% increase. And the time to exhaustion was longer, roughly 8% longer before they got fatigued. So you can imagine that if you're in a sport like soccer or any running and you're able to last longer, your muscle tissue is less prone to be injured, right? And that's the whole goal here, is that you're trying to prevent injuries by pre-treating these muscle groups so that when they're out there doing the event, you can actually help to reduce the potential injuries. And so you know what? You may even be a trainer, for example. Or an athletic therapist, and you can be out there with a mobile system and doing this at the bench at halftime, that kind of thing as well, or hockey or whatever it is. So they concluded that there was increased endurance, decreased blood lactate, decreased creatine kinase, and decreased C-reactive proteins. These all suggest that laser therapy applied before the exercise could be very helpful to delay fatigue during repetitive tasks and possibly help recovery. This particular paper was a fairly recent one, and it looked for photobiomodulation with respect to oxidative stress, muscle damage, and function after electrical stimulation or neuromuscular EMS. It was 24 men, 21 to 22 years of age, and they received 45 isometric contractions with a EMS on the quads, and that was done just before laser therapy or placebo laser therapy. Then they looked at maximal isometric voluntary muscle torque, perceived muscle soreness, and they looked at different markers in the blood as well. So they measured these markers, creatine kinase, C-reactive protein, which is for inflammation, and they evaluated redox state parameters. This is what it looked like. You can see the pads, that's the EMS, and you can see the monitors, electrodes, to measure what was going on with contraction. So these evoked contractions induced oxidative stress, obviously. So we're looking at, significantly contracting the quads until they became quite sore. And laser therapy irradiation had what was deemed a protective effect after these contractions because it caused a decrease in enzymatic antioxidant defense and shortened the duration of inflammation. I won't go over all the actual data because I just don't have the time to do that, but the reference is marked below. So the development of muscle fatigue is fairly complex. This particular paper looked at soccer players, and again, they were looking to see if photobiomodulation, before soccer players did a progressive running test, what kind of effect it had on inflammation, oxidative stress. So with respect to these athletes, it's very important to understand that their recovery needs to be as fast as possible and as effective as possible. So they looked at 22 high-level male soccer players, and they were either treated with photobiomodulation or placebo. And immediately after the application, they performed a standardized high-intensity progressive running test. So they measured VO2 until exhaustion, creatine kinase, and all the different markers of inflammation that I've talked about earlier. So pre-exercise photobiomodulation, they concluded it seems to play an important antioxidant effect, decreasing exercise-induced oxidative stress and consequently enhancing athletic performance and improving post-exercise recovery. And there is a lot of this research. And this is just a tip of the iceberg. The last one was on hamstring and preventing hamstring injuries. And again, they looked to see whether or not photobiomodulation helped to do that. So this is what the device looked like. It's actually very similar to a BioFlex Dual 240 array, except ours is a little bit smaller and has a much higher density of lights. They actually used LEDs, not lasers here. Wavelengths 880, so a little bit higher in the spectrum. And this paper showed that evidence supports the absorption of light, obviously through the mechanism through ATP production and cellular metabolism, and also improving microcirculation and oxygen supply. So when they applied it to posterior thigh muscles, the hamstring muscles, immediately before a simulated soccer match, it actually showed to be very effective in attenuating fatigue-related impairments in hamstring maximal eccentric strength, the hamstring quadriceps strength ratio, as well as the performance of the muscle groups. So the idea here is that soccer players in particular are prone to hamstring injuries because the quads are so much stronger than the hamstrings. So when they become fatigued, they become weak, and then the quadriceps, which in relation are so much stronger, that eccentric imbalance causes the hamstrings to tear or to injure. So you can imagine that for a soccer player, if you're trying to prevent these injuries, it makes sense to pre-treat the hamstring before the event to help prevent the potential for hamstring injury. Okay, so how would you use our equipment? Well, the first thing you're going to do is go to the customized setting. Click on that. Click on the array that you're using, in this case a Dual 180. And once you've done that, then you're going to look at creating this customized protocol. You're going to choose your array, which is a Dual plus 180. You're going to click on modulation. I'm going to start at 50-50 or 50 hertz, 50% duty cycle. This is a very standard kind of protocol for muscles. You can even tweak it up to 70% duty cycle, but it's a good start. And time-wise, if you're treating hamstrings, quads, calf muscles, use about 8 minutes here. Notice that we're just using infrared and not red because we want to maximize the light into the muscular tissue as deep as possible. Then the step 2. Now again, you're going to choose the number of steps according to the number of placements that you're using, right? So in the case, let's say we're treating a hamstring with 2 steps, you're going to choose a second step, and again choose the Dual 180 array. Same thing, you're going to treat a modulation 50-50 for 8 minutes. So that's your protocol. So for example, you're going to place one array over the muscle bellies of the proximal hamstrings, and then of course over the distal hamstrings, and that would be your protocol. So roughly 16 minutes of infrared dual will be a nice sort of protection for these hamstring muscles. Similarly, for the gastrocs, you could probably just place one array, depending on the size of your patient, parallel or vertical to the gastrocnemius. Another option is if you have a very sort of tall player, say basketball player or what have you, you might have to do 2 placements, more actually perpendicular to the muscle bellies. But depending on the size of your patient, this is probably a good fit. And again, if you want to treat the quadriceps, oftentimes you probably have to do 2 placements to adequately cover both the proximal and the distal muscle groups of the quadriceps. Okay, so that's half an hour. I went through it fairly quickly just because there's so much information on this topic. I am doing a online training next week. It's only $199 Canadian, so it's fairly inexpensive. If you haven't yet been certified to use Class 3B laser devices, I highly recommend the course. It's all day on the Friday, either July the 17th from 9 a.m. to 4 p.m. Or on Friday, August the 21st, again from 9 a.m. to 4 p.m. Again, only 199 Canadian. That's probably like hardly anything in US funds. So if you have a chance, or if you wanted to even bone up on your knowledge, it would be a great course to take. Any questions that you have, I'm going to open those up right now. If you want to email me at any given time, please feel free to do that. My email is david@bioflexlaser.com. If you're listening to today's webinar and you're interested in some new equipment or even a special rate right now that we have with respect to, I can't actually talk about it online, but if you're interested in knowing about perhaps new what we have going on new device-wise, or some really good lease rates or discounts, just give me an email and I can help you out with that as well. So let's get to some questions. Let me just see here. Actually, interesting. I don't have any questions, so not sure if you guys have any questions or not. Usually I get a few. Okay, so I do have a question here. I thought that inflammation is an important part of tissue healing. It sounds like laser stops it. Elizabeth, that's a good point. So we're not actually stopping inflammation. What we're doing is we're accelerating the inflammatory time frame. So normal inflammation that the body creates is important for the healing process, which is I think what you're referring to, Elizabeth. However, the thought process here is that the body oftentimes extends the inflammation and prolongs it. So we want to recover as fast as possible. So what laser therapy will help with is actually resolving the inflammation and the tissue damage faster than the body would actually do it on its own. So hopefully that answers your question. Have you ever received laser therapy yourself, and could you comment on how effective it could be? Yeah, that's why I'm here. So the question is from Marianne. 10 years ago, I fell off a roof, and I had some spinal fractures, separated shoulder, completely tore my medial head of my gastrocs, and after I couldn't practice anymore as a chiropractor at that time. And after about a year of therapy, I was still having a lot of issues. So I ended up coming here to the clinic. And that's what started me on my sort of journey to understanding a little bit more about photobiomodulation. It really was the only thing that helped me get past to the point where I was able to get back to normal. So I play squash, I run, I do everything I need to do with half a gastroc and some pretty serious injuries that I've recovered from. And of course, over the years, I've had other injuries like epicondylitis and muscle strains. I use it prophylactically a lot as well, just for a wellness basis, or if I'm doing sports, to help recover, just as I've mentioned in today's webinar. To treat before a sports event, how long before the event would you treat? That's a good question, Brian. The thinking here is that an hour to 2 hours would be the maximum time frame, and probably within the hour before the event would be the most ideal time to treat. And then after an hour or two, within an hour or two after the event would be the other good time frame to treat. I was on the roof. I was on my roof because I was redoing the shingles, and I had a big tarp on it. And there was a massive thunderstorm, and it blew off the tarp, and rain started to pour in my house. So as I got up there, I slipped, fell off, and that's what happened. Okay, listen, thanks everyone for attending today's webinar. I do have another webinar coming up in 2 weeks on a personal system. I think it's for knee injuries. I can't remember what it's on. And I'm going to list a whole series of new webinars. I'm basically will be having a webinar, 2 webinars a month, along with a training every month. So there's an event happening every week, most weeks here at Meditech. So please go to bioflexlaser.com and under events, and you'll see everything that's going on. I really appreciate you guys listening in today. And please send me any feedback or any inquiries that you have. Much appreciated. Thanks very much.